It's not a secret, COVID has created more challenges than we can keep track of at this point, some big, some small, but things in Idaho continue to trend the wrong way, and fast. It highlights problems we hoped our community would never face. But here's one for you, and I'm going to say this one bluntly. In Idaho's most populated county, we are overloading the county coroner with too many who've passed because of COVID. And last year, the Ada County Coroner's office brought in a refrigerated truck to handle the expanded caseload brought on by COVID deaths. The coroner's office ran out of space then. Today, 18 months into this pandemic, that space is needed again, plus some. Between two separate trucks, the Ada County Coroner's office has room for about 90 extra bodies when their facility space runs out. And running out of space is an everyday battle these days. Things are on such a bad trajectory. At this point, it begs the question, what happens when space runs out again?
We are actually very overwhelmed. Our entire office staff, facility, everything that we're doing, we are operating at capacity.
The surge in Idaho COVID cases is creating major issues for crucial community services.
But it's burnout.
Just ask Ada County Coroner Dottie Owens. She says the heavy COVID caseload her office is dealing with comes with major consequences.
We're 6 months down on pathology reports, which is very, very hard. It holds families up for insurance benefits. It's every single aspect, from administration to forensics to my investigations team. We are operating at capacity.
Last year, the Ada County Coroner's office was forced to purchase a refrigerated truck to keep up with COVID deaths. Owen says they need that extra space now more than ever.
Our normal cooler is full, and our mass fat trailer has 5 decedents in there.
When I speak with frontline healthcare workers, they describe a similar scenario where they're doing everything they can, but they're simply overloaded. How would you compare your situation to what frontline healthcare workers are going through?
You know, we're dealing with the exact same thing. We really are. And between our facility challenges, our staffing challenges, you know, we're just really operating at capacity on all levels. And what we're doing is we're nursing it through. We're doing everything we can to nurse it through.
Where do you go from here? And I guess just you keep pushing through. I guess, how do you keep doing this? And I keep asking this to frontline healthcare workers as well.
You know, you do. You show up because we're here for our families. We're here to make sure that we try to keep our community safe. We show up, we do the job, we go home, and we do it all over tomorrow. We were discussing this internally this morning, and everybody is just, you know, the comments of, we're just exhausted. Why don't people believe this? Why don't they believe in this at this point? It is so frustrating. When we're doing death notifications and we're on scene with these grieving families and we're hearing from spouses, why didn't we believe this? Why didn't we do something with this up front? What do you say? We're desperate.
And it sounds like you get some pushback when you talk about COVID deaths.
I get a lot of pushback. I get told that we're, you know, making money off of COVID. I get told we're fear mongering. I am telling you, at the end of the day, we're the ones that are laying eyes on these deceased individuals. We're the ones dealing with the grieving families. There's no financial benefit for county when we're dealing with this.
There's no benefit to the coroner's office at all.
There's no benefit to us at all, because on top of it, what people forget is that not only are we doing the COVID and we're monitoring the pandemic piece, but we're also dealing with the suicides and the homicides and the children deaths. And, you know, we handle all of that. There's no benefit at all for any of us.
I can hear it in your voice, the emotion and the passion, but I'll ask, when people are pushing back and you're seeing this day in and day out, and your staff, you're seeing this day in and day out, I mean, what are your thoughts when someone just so flippantly says, no, this isn't real, it's a hoax?
It's really hard for me, to be honest with you, Joe. Emotionally, it's hard for me because we see these families firsthand. We see these healthcare workers. We're talking to the hospitals, funeral homes. There's no end to it. And I don't understand why people don't believe in this at this point. I have no words. My staff is so frustrated. They're frustrated and they're exhausted.
Owen says earlier this summer, the situation actually looked pretty good as COVID deaths steadily decreased in our community. But that all changed in recent weeks.
For a while, we were only seeing one or two a week. And then it gradually increased to 2 a day. And now we're getting multiple that are reported to us daily. Yeah. We're seeing that on the tail end. I believe we're over 60 on the month that we've laid eyes on for just September. You know, for me, honestly, there's a lot of frustration. There really is. There's a lot of frustration. There's a lot of grief. I don't understand why these lives don't matter anymore. I don't get it. I don't understand why we aren't taking this serious. Why are we not shutting this down? It's a lot of frustration. And I hear that every single day when I walk into this office. We say anything, anyone in this office says anything about it, and we're fear mongering. We're lying. I don't understand that. Why don't the numbers speak for themselves for this? I just don't understand that.
Owen says recently their smaller mobile trailer was dispatched to help cover issues in another county. She knows that trailer is likely to see activation again soon.
At any moment, a region can get into trouble and we'd have to haul that up there for them, or a hospital here or somebody. So we've got both trailers in our parking lot right now and we're going to hang on to them.
Is there fear that those trailers may not be enough?
Sure. We know what our bed capacity is for morgue space in the county, and we are monitoring that every single week.
Some important context I want to lay out after that story. The Ada County Coroner's Office is handling deaths that happen in Ada County, but that includes people who were taken to an Ada County hospital from outside the county. So think about it. We have several major hospitals that people come to in Ada County from well outside our area. Now, Owens tells me that one example that she can think of recently, a patient was life flighted from Montana. They ended up passing away from COVID. Now, that death isn't reflected in Idaho or Ada County numbers, but regardless, the Ada County Coroner's Office still has to handle it, and it's in their records. So they're dealing with a lot more than the state or county numbers could ever indicate. And let's talk about data. We got a fresh set of numbers today from the Ada County Coroner's Office that indicates exactly what they're dealing with. We told you the personal aspect. Let's talk about some data. And we narrowed it down to a few major takeaways. Now, since the pandemic began early last year, there's been 799 deaths that have been reported from the Ada County Coroner's Office. Again, not all those deaths were from Ada County residents, but the deaths happened in Ada County, and those bodies were brought to Dottie Owens in the Ada County Coroner's Office. We're going to show you some graphs here. You can see that December 2020 was a very difficult month. There was 152 deaths there in Ada County that the Coroner's Office dealt with, and that averages out to about 4.9 deaths per day. But this month, it's looking like we could actually break that record. We're going to take a look at this year through yesterday, September 20th, 96 deaths, and that's about 4.8 deaths per day, with another week and a half to go in the month. We are on track to match December at least. And the average age of those dying continues to go down. At the start of the pandemic, back in March of 2020, the average age of those who died from COVID was just over 76 years old. And you can see how it breaks down from there on your screen, all in the mid to late 70s in 2020. But this year specifically, the summer, that average has dropped. It is now to its lowest, to 62 years old in July. So far this month, we've seen 10 people die from COVID who were under the age of 50. Compare that from January to August of this year, where we had 12 die who were under the age of 50 in total. Again, this is only for deaths reported from the Ada County Coroner's Office. We've got a breakdown of this data on our website right now, ktvb.com.